Hello, everybody. This is Matt with Provider Trust. First, I want to say thanks so much for signing up for today's webinar. We're very excited. We have some great guests here. They know a lot about the topic and have some great info to share, so you're in the right place. And yeah, thanks for joining. So today's presenters, we have Alex Fisher. You may recognize from a webinar we did last year. Alex is a senior associate with Frost, Brown, and Todd, and she has a history of defending professionals in the healthcare industry around licenses, particularly nurse practitioners, physicians, and physician assistants. And we are happy to have her back. And we also have Erin Tolbert. She is a current practicing nurse practitioner and owner and founder of Mid-Level U. Those of you that may not be familiar with that, Mid-Level U is a platform that Erin developed out of her passion for her career, where she strives to support nurse practitioners throughout the ups and downs of their careers. And she has a lot of great content at Mid-Level U. So we're so happy to have the pair of them here to get some great information to you, or to everyone here. A little bit about us, Provider Trust. We are in Nashville, Tennessee. What we like to say is the healthcare capital of the world. Our founders, Mike and Chris, who you may have seen on past webinars, we're really passionate about compliance in the healthcare industry and making that simple for compliance officers, HR professionals, procurement, and people that work in those kinds of roles. So moving on to a little bit of a quick overview for our webinar today, just so you all know what you're getting into. Goals and objectives, differences in state regulations, enforcement of regulations by state nursing boards, best practices for state regulatory compliance, and tips for onboarding. Please feel free to submit any questions you might have during the webinar, and we will get back to you after the webinar. We will also be sharing a copy of the slides as well as a recording for anyone who wants to submit this for CEU credit. We are also pending certification from the CCB, and once we are approved for this webinar, we will share that form with you all, and you can submit it. So we are excited to offer CEUs now, and looking forward to working with you all and making best out of what's going on with your organization. So I will pass it on to start to Alex, and we'll get going with goals and objectives.
Sounds good. Thanks, Matt. Thank you for having me here today along with Erin. I'll get started with the first three of our 5 things to know when hiring nurse practitioners, and I'll hand it over to Erin, who has the actually useful information for all of you today. And like Matt mentioned, we are both available for any questions you may have. So if there's something we don't cover today or that we touch on that you'd like to hear a little more about, please reach out to myself or Erin. We will happily get back to you on that. So our goal today is to educate employers and partners seeking to utilize nurse practitioners in their practice on best practices for regulatory compliance state by state, tips for onboarding nurse practitioners, and how to improve retention of nurse practitioners in your practice. So you already heard a little bit about Erin's passion. She's a nurse practitioner. I'm a healthcare attorney. I've worked with a lot of nurse practitioners here in Tennessee and across the country. They are a fantastic group of healthcare providers who really provide a lot of service within the healthcare space, but they're definitely in a unique niche. So Erin and I hope to kind of touch on some points for you today that you can take back to the places where you work and hopefully implement them so you can use nurse practitioners more effectively. And then our objectives, I'll go through the first 3 and then I'll hand it over to Erin to talk about the last 2. I'm going to talk about distinguishing differences in state regulations of nurse practitioners. So unlike being a medical doctor, for example, it can look very different to be a nurse practitioner in one state to the next. 2, I'm going to explain the enforcement of state regulations by state boards of nursing. So what do those regulatory boards really do, and what are they looking for when they're potentially enforcing these regulations that vary so much? And then finally, I'm going to talk about some best practices for state regulatory compliance. And then I'll hand it over to Erin. Erin, do you want to talk about briefly 4 and 5 here, our objectives?
Yeah, certainly. So the fourth thing we're going to talk about is onboarding of nurse practitioners. How do you get somebody started successfully in your facility to maintain that employment relationship once you do your work on the front end by understanding your state regulations? And the final thing we'll talk about is how do you structure compensation in a way that improves retention, delineates the expectations that you have as an employer, and really incentivizes your nurse practitioners to get things done in the way your practice wants them to get done.
Great, thank you. So we'll get started with the first one there. What are some differences in nurse practitioner state regulations? So obviously we don't have time today to go through all 50 states and how their regulations vary. Also, I don't want to put you all to sleep by going through all of that. So we'll just start by talking about a broad overview of how the regulations vary state by state. And you can see this map from 2017, the American Association of Nurse Practitioners produces, and they categorize all 50 states as falling into one of 3 categories, really. The green we have is full practice, so where nurse practitioners can really practice to the fullest extent of their education and background, particularly as it relates to prescribing. For the yellow states you see on the map there, those are considered reduced practice, and again, this is as defined by the American Association of Nurse Practitioners, so this isn't a universal definition, but I think it's a helpful tool when we're thinking about how state regulations differ. And reduced practice is nurse practitioners can practice to a fairly great extent under their license with some restrictions that may be imposed. And then finally, the red states are considered to be restricted practice. So states that maybe have a lot of regulatory overlay when it comes to what nurse practitioners can do, particularly, and we'll talk about this in a moment, as it relates to prescribing. So I'm just going to go through 2 examples of state regulations and how they vary, and you can really see the difference from one to the next. So the first one I'll talk about is Tennessee, because that's where we are here in Nashville at the Provider Trust headquarters. Tennessee is considered a restricted practice state. So what does that mean? It's a state where practice and licensure law restricts the ability of a nurse practitioner to engage in at least one element of their practice. The state will require supervision, delegation, or team management by an outside health discipline, so outside of the nurse practitioner space, in order for the nurse practitioner to provide patient care. So how does Tennessee actually regulate nurse practitioners? So in Tennessee, just first, to be a nurse practitioner, a provider has to have a valid unencumbered license as a registered nurse, a master's degree, and a current national specialty certification in their appropriate nursing specialty. These 3 requirements are pretty universal in most states to just be a nurse practitioner. And then where it gets a little complicated is when we start to talk about prescribing. So in Tennessee, for a nurse practitioner to write prescriptions, any prescriptions, they have to get a certificate of fitness from the Board of Nursing, which in addition to those 3 requirements we just talked about, the registered nursing license, the master's degree, and the national specialty certification, requires 3 hours of pharmacological instruction from their master's program. If the nurse practitioner intends to write prescriptions for controlled substances, they have to have their DEA certificate to prescribe controlled substances, and that just has to be at their practice for inspection. It doesn't have to be filed with the Board of Nursing. And then finally, if the nurse practitioner has been issued a certificate of fitness, they have to file with the Board of Nursing. So this isn't something you maintain on site. This actually has to be on file with the Board of Nursing. Their name, what drugs they'll be prescribing, and the name of their supervising physician. Some parts of the statute here in Tennessee have changed that to collaborating physician. Most of the language still says supervising. Here in Tennessee, at least, there's not a difference in that distinction. So what does that mean, though? If you hire a nurse practitioner in Tennessee, they have to have this supervising or collaborating physician. That person's name has to be on file with the Board of Nursing, along with whatever drugs that nurse practitioner is going to be able to prescribe. And that has to be updated every 30 days. So let's say that supervising physician you have at this practice with the nurse practitioner moves to a different practice, leaves the practice within 30 days, you're going to have to update that information with the Board of Nursing, and obviously extrapolate that out to how many nurse practitioners you're utilizing. That's a lot of information that needs to be updated in a timely manner with their regulatory board. I have one quick note here. In Tennessee, under statute, we have a requirement that any prescription written and signed or drug issued by a nurse practitioner under the collaboration with and control of a collaborating physician, see where that language changed just last year from our state legislature, that prescription will be deemed to be that of the nurse practitioner. And you'll see this quite often in states. So even in states where a nurse practitioner is highly regulated and has to have this partnership or collaboration with a supervising or collaborating physician, it is still their responsibility at the end of the day, whatever prescription they've written. And that's really important when we talk about how the board enforces these regulations in just a minute. So of course, if there's a supervising physician, what are that supervising physician's requirements? Again, we're talking about Tennessee as an example here of one of the more restrictive practice states for nurse practitioners in the country. So in Tennessee, the supervising physician has to jointly develop protocols with the nurse practitioner. Those are maintained at the practice site. They don't have to be filed with the state. The supervising physician has to review at least 20% of the charts of all patients that the nurse practitioner has seen every 30 days. They have to review 100% of the charts where a controlled drug prescription has been written, and they have to certify that. And that review has to happen within 10 days, but they only have to sign off on it every 30 days. And then finally, if the collaborating physician is in a different location, they have to visit the remote site at least once every 30 days. So obviously we see what started out as pretty straightforward to be a nurse practitioner in Tennessee gets a little complicated when it comes to prescribing and these requirements for a supervising physician. Now, by contrast, let me talk you through what a full practice authority state looks like. For example, Nevada. So in Nevada, it's a full practice state as defined by the American Association of Nurse Practitioners. And that's a state where the state practice and licensure law allows nurse practitioners to really practice to the fullest extent of their license. So same three requirements we saw earlier in Tennessee. To be a nurse practitioner in Nevada, you have a registered nurse license, a master's degree in nursing, a national certification as an advanced practice nurse. To prescribe drugs as a nurse practitioner in Nevada, you have to basically submit an application for authority to do so. Obviously, you still have to have a DEA registration number to write prescriptions for any controlled substances. That's required at the federal level by the DEA. And you've had to take some master's courses in pharmacotherapeutics in your master's program, which is pretty standard these days. So you saw we just spent maybe 4 or 5 minutes going through all the requirements to prescribe in Tennessee. In Nevada, you're submitting an application. You're not dealing with these joint protocols with a supervising or collaborating physician. What your scope of practice looks like is pretty different. And frankly, what your day-to-day autonomy is going to look pretty different in Nevada compared to Tennessee. And those are just 2 states out of the 50 in which you may be utilizing nurse practitioners. It's important to realize how you can utilize nurse practitioners in different states, what's required, how often you're required to update that information with your state, so that you can use nurse practitioners in a way where they're practicing to the full extent of their license in the state where they're licensed. So what does the enforcement of regulations by the state nursing board look like? Right, so we have all these different regulations. They're only as good as the actual enforcement by the board. So I'm going to step back for a moment and give us a little broader view of state licensing boards. Obviously, this goes without saying. Everyone here on the webinar knows healthcare is a highly regulated space. So I'm specifically talking about these state licensing boards when we're talking about nurse practitioners. And specifically, I'm talking about the state boards of nursing. In about 10 states, the Board of Medical Examiners or an auxiliary board may have some authority to regulate nurse practitioners, but in the majority of states, we're looking at the State Board of Nursing. That's going to encompass LPNs, RNs, and APRNs. And that state board will award licenses to those individuals. They'll set forth the educational curriculums and standards for any nursing programs in that state. Their job is to safeguard the health, safety, and welfare of the public. So their job is really public focused. They interpret the statutes and rules to determine when someone's maybe violated those rules. And then finally, these boards can discipline licensees found guilty of violation. Those discipline options can look anything like a civil penalty to revoking someone's license. So what's the state nursing board's role in the enforcement of regulations? And I think this is important. Again, healthcare is a highly regulated space. How does this board differ from maybe other ways in which nurse practitioners may be regulated? So the state nursing board is going to judge nurses and nurse practitioners based on behavior, not on patient outcome. So for example, there's a complaint against a nurse practitioner. They're really looking at their behavior, not patient outcome. This is important because this space, the state regulatory board space, is really different from, for example, medical malpractice liability. And so just to distinguish the two really quick, for a medical malpractice lawsuit, what you have is a patient or a patient's representative suing a nurse practitioner in civil court for money because of an adverse outcome, right? We all know that's what a medical malpractice case looks like. That's what most healthcare providers are kind of laser focused on avoiding because no one wants to deal with that. By contrast, when you're looking at the state board of nursing, they are concerned about the behavior. So let's say a nurse practitioner shows up to work impaired, or they're not documenting properly. Even if there's no adverse patient outcome, the board is still very concerned about the behavior. And this is a potential disciplinary process that's led by a state board, not by a patient or a patient's representative. They may have initiated the complaint, but for it to go any further, it's led by the state board. And what's on the line is not money, it's someone's actual license to practice for the rest of their career. So to go along with that, the state board is going to distinguish between human error and intentionally reckless behavior, right? So what a plaintiff's attorney may take on as a medical malpractice suit, yeah, we can sue him for that. There was this bad outcome. Your state board is going to distinguish and say, no, this was just human error. This is something that happens in the practice versus something that was intentionally reckless. They will take action to ensure public safety. And, everyone is very, very aware right now of the context in which healthcare providers are practicing. So I think it almost goes without mentioning, but in light of the current opioid epidemic, these state boards are under a lot of pressure to make sure that they're regulating their providers who can write prescriptions for controlled substances. So the way in which these boards are regulating has changed dramatically in the past 4 or 5 years from what it looked like 5 years ago. And then finally, the board will have the expectation that nurse practitioners create records showing their rationale and underlying medical diagnosis to justify prescribing. I would say documentation and going along with it, potential overprescribing are two of the biggest issues for which a nurse practitioner today might have a potential complaint or potential discipline in dealing with their board of nursing in whatever state they're in. So what's the responsibility of nurse practitioners in interacting with their state nursing board? Nurse practitioners need to know and understand the regulations and laws governing their practice. We saw earlier what you have to understand in Nevada as far as it goes along with prescribing is going to look very different than what you have to keep up with in Tennessee, or for example, Kentucky or California. And that is incumbent on the nurse practitioner. So as an employer or someone who's looking to employ nurse practitioners, this is a place to think, how can you empower your employees to make sure that they know what the regulations are for their license in the state where they're practicing? They have to know what's inside their scope of practice and maybe even more importantly, what's outside of their scope of practice. They need to understand the state regulations related to their ability to write prescriptions for scheduled and non-scheduled medication. So you saw in our example with Tennessee, it was pretty standard. It didn't really distinguish between scheduled and non-scheduled medications. That's different, for example, in Kentucky. There are different documents you even have to file with the state board if you're writing controlled substances or prescriptions for non-controlled substances. Nurse practitioner needs to understand the supervising or collaborating physician's responsibilities. And of course, this is something as an employer you want to be aware of as well. If you're employing someone and part of their job title is to supervise or collaborate, is that person actually doing their job? The nurse practitioner needs to document treatment of every patient. And then, of course, report as required by state law, healthcare judgments and settlements, criminal convictions. This has to do with their own personal criminal convictions, if anything in their background changes, and board discipline from other states is required. So we already talked about how in Tennessee, If your supervising physician changes, you have to report that within 30 days. Same goes for many of these other principles. In Tennessee, if a nurse practitioner gets a DUI, that needs to affirmatively be reported within 30 days of final judgment. If they're disciplined in another state, that has to be reported. And each state differs a little bit in what needs to be reported to the state board and how quickly that needs to happen. There's another space in which an employer can come in and really empower their employees by making sure they're aware of what the regulations are in the state where they're practicing. All right, and I will leave you with this last one and turn it over to Erin to give you, again, the actually useful information about how to hire and keep really high quality nurse practitioners. But what are some best practices for state regulatory compliance? And we'll stick with our theme of 5. So I have 5 tips for you on best practices for compliance. The first one is that nurse practitioners should document thoroughly, accurately, and appropriately when treating patients, particularly when writing prescriptions for controlled substances. This really, frankly, almost goes without saying, but again, I like to put this in the context of we're in the middle of an opioid epidemic here in Tennessee, where I live in practice as well. There are a lot of different policies being put in place, a lot of different political entities that are trying to shift and respond to what's happening in our society right now. And nurse practitioners and medical doctors are really at the forefront of those being most highly regulated. So if nurse practitioners want to protect their license, protect their practice, protect their employers, documenting is the best way to do that. 2, nurse practitioners need to review their state, if applicable, and federal guidelines on the treatment of chronic pain if that's a part of their scope of practice. So in Tennessee, we have guidelines for the management of chronic pain. Most states do as well. So if you're an employer who works in a space where you're treating chronic pain, this is a really important thing to work with your providers on to make sure they're aware of both federal and state regulations. Nurse practitioners need to have clear written protocols and expectations with their supervising or collaborating physician, if applicable, right? This doesn't apply everywhere. But as you saw on that map earlier, a lot of the states in the country are still yellow or red, which means you're probably going to have some overlay of a supervising or collaborating physician. And I think this is really an opportunity for employers to put someone in place who really can be a mentor to nurse practitioners and work with them and not just collect a paycheck and part of that says you're a supervising physician, but have that really be an active role to support and train nurse practitioners on the job. And that starts with having clear written protocols and expectations for both parties. Number 4, utilize your state prescription drug monitoring program and use this data to implement best practices for yourself and your patients. And then comply with all guidelines related to the state PDMP in terms of reporting and utilization. So again, this is one of those areas in which states really differ. In Tennessee, we have certain requirements in terms of how often you have to use what we call our CSMD, our Controlled Substance Monitoring Data Bank, to check and see if a patient may be receiving the same prescription from other providers, they're receiving other prescriptions that would contradict or contraindicate the prescription that you're thinking of prescribing. Each state handles this a little differently, but there are usually some pretty clear guidelines on how you have to utilize them and anything you have to report if you see something abnormal in your state prescription drug monitoring program. And then finally, and this is really just minding your P's and Q's, nurse practitioners should timely renew their licenses, complete continuing education, file any necessary documents with their state boards. We already talked about this, right? Every 30 days. If it's required to update, if you have a new supervising physician, that needs to be updated. And I would say number 5 is really important, even though, again, it seems very intuitive and explanatory, because if a nurse practitioner does have a complaint against their license, and they can say, look, I have been doing everything right for the past 2 years or 10 years, the board's going to look at that in a different light than if there's someone who doesn't renew their license on time, doesn't do their continuing ed on time, doesn't update things on time, and then something else comes up. Well, it looks like there's someone who maybe doesn't respect the authority of their state board, whether that's true or not. So this is a space where employers can really come in and support their nurse practitioner employees by giving them the tools they need, by putting things in place to make sure that they are in compliance in all the ways that they can control. So when something happens outside of your control, like an upset patient files a complaint, it's really an outlier in terms of this nurse practitioner's excellent record with the state and not kind of the norm for your company. So I have a few resources for you here before I turn it over to Erin. Health Law Matters, it's a blog I contribute to through my law firm, Frost Brown Todd. Has some relevant legal perspectives for the healthcare industry, not just from the regulatory and compliance perspective, but dealing with some other federal and state issues as it relates to the healthcare industry. The American Association of Nurse Practitioners, updated information regarding regulations state by state. And finally, the State Board of Nursing website for whatever state you're in. There's a comprehensive list of those state boards with the National Council of State Boards of Nursing. And that is all for me. Erin, it's your show from here.
All right, so the final two things that we're going to discuss today that you really should know as an employer when you're bringing a new nurse practitioner onto your team is about onboarding, number one, and then compensation. Why do we really care about these things? I have a little bit of a unique perspective in that I'm a nurse practitioner myself, but through my company's programs, really work primarily with employers and hear a lot of their feedback about their nurse practitioner employees, what's going well, what's not going well, a lot about their frustrations and kind of ways they've approached that. And one thing that I've really found are there are two themes that onboarding and compensation really impact the health and success of that employment relationship. They're important when it comes to the efficiency and productivity of your providers, right? You want your providers to be really productive, generate a lot of revenue for your hospital, your clinics, whatever it may be. And so setting those two things up intentionally can create success from that standpoint. You want competent, confident providers. We just talked a whole lot about compliance and a lot about state laws and regulations, and you want nurse practitioners working for you who can live up to those standards. And so onboarding really, really touches on that and helps bring them up to speed in those areas. Turnover is a huge issue for employers that I talk to. We'll touch on that a little bit more in just a minute, but it's really disruptive in your workplace to have a lot of turnover. It disrupts patient relationships. It disrupts the view the community has of your healthcare facilities. And so this is very, very important. And by doing a little bit of work on the front end when it comes to onboarding and compensation, you can really make an huge impact on that and reduce your rates of turnover in your practices. And then finally, workplace culture. We all want to work in a good, healthy environment, and people leave their bosses, not their jobs. So you might say, we have really, really difficult patients. Our patient population, can be really frustrating to work with, those types of things. It is under your power as an employer to help your providers work with those types of patients or work in maybe a more difficult or complex setting successfully. And onboarding and the way you structure your compensation really impact that. So because turnover is such an issue for a lot of our employers, I'll go into a little bit more detail on that just to give you a little bit of incentive as to why you should put so much time and energy structuring onboarding and compensation up front, because it does require time and energy, and because it saves you all this work and prevents all this lost revenue on the back end. So say we have a scenario here where you've got a nurse practitioner fed up with their job, they leave, and that NP has been working about 8 hours a day, treating about 3 patients an hour. Say that NP billed pretty much every patient about a basic office visit code, and you are reimbursed by Medicare for those visits. So it's kind of representing a lower paying scenario here. That vacancy represents almost $1,500 a day in missed revenue for your facility. For businesses that fail to fill job openings within the first month that position is vacant, there's a more than 50% chance that the position will remain open for 3 months or more. So if you have, a vacancy for 3 months in your practice and you don't have a provider to fill that gap, you miss nearly $90,000 in revenue related to that position turning over. In reality, that cost is really a lot higher. that NP's probably billing, even higher office visit codes. It doesn't take into account ancillary services. If you're an inpatient facility, chances are you're getting reimbursed a lot more than outpatient facilities. So turnover is very, very costly from a financial standpoint. We also see that in addition to those financial costs of turnover, it takes the time of existing staff to interview, hire a new provider, get that new provider onboarded. You also have those extras that come with hiring somebody new, things like sign-on bonus, interview costs, relocation allowances. And so that time up front it takes to be intentional about the way you're going to bring somebody onto your team and the way you are going to compensate them for the work that they do is really worth it, because you're probably doing all this work on the back end if you don't structure that employment relationship for success. So let's talk a little bit about onboarding for just a minute. One big mistake that I see a lot of facilities make is they think that all nurse practitioners are created equally. So let's talk a little bit about that. Nurse practitioners go to school for about 2 years after a bachelor's degree, and that's about 2 years part-time. 1 year, maybe 1 year plus full-time. Some NPs will have prior nursing experience, some NPs will not. And then there's also this new doctorate of nursing practice that has a lot of confusion around it. There's sort of an push in the academic world to have nurse practitioners now get a doctorate. It's a big fancy title. In reality, I don't see that it confers a whole lot of extra clinical experience. It involves doing a project, some research, some additional classes, and a little bit of clinical experience. But in reality, when we look at the education of our providers, nurse practitioners and physician assistants, when they come out of school, still have a little ways to go. They've gotten a great foundation. I don't want to downplay anybody's education. I'm a nurse practitioner. But there's a lot of on-the-job learning required. So let's look at a little bit of a comparison of the length of education. So, as an NP, I started in a clinic, first day on the job, jumped in, had a full patient schedule, and just like the physician I worked with was expected to go and see all these patients. But as we can see here, I went to a 2-year graduate program instead of a 4-year program like a physician. I had no residency, where a physician has a 3-year residency. And so received overall a lot less education. So to see the same patients as a physician, I've got to make up for that gap somewhere. We can also see, if we hone down a little bit, the number of actual clinical hours, if we look at our next chart, that each receives in their practice. So as a nurse practitioner, I got about 750 clinical hours. So that's hands-on patient hours as part of my training. Physician assistants typically get about 2,000. Whereas physicians, we see they have about 15,000 hours of hands-on patient care experience by the time they finish school. So we have this disparity here. We go on, nurse practitioners can theoretically, so it's within our scope of practice, like Alex just talked about, to manage about 80 or 90% of the care provided by primary care physicians if you're in the primary care setting. But when we come out of school, we might not be at that 80 to 90% landmark, because we've only got about 5 to 10% of the number of actual hands-on clinical practice hours as part of our education as nurse practitioners. Not to mention, where we went to school, where we completed our clinical training, all plays a part in the quality of that education. And so the solution is really effective onboarding for your new provider hires. Even if, you're hiring experienced nurse practitioners alone, we do still see, it takes a while to get this kind of education gap up to speed. If they're switching specialties, they still may need, a little bit more help along the way. So the solution to this problem is on-the-job experience, right? Your nurse practitioners have a ton of potential. Like Alex talked about, they've got a big scope of practice in a lot of states, but to really tap into that potential, it's up to you as an employer to get them from point A to point B. How are you going to do that? There are a few different ways you can do that. The first is mentorship and support. A second would be well-communicated expectations. You need to let your new nurse practitioners know, I understand that you're, have a great clinical foundation. Maybe you've got 2 years of experience. I want to get you to where you are, really competent at these, 5 procedures, or can see patients really efficiently in our practice, or however you measure success in your facility. You need to communicate that to your NPs. And then effective management, checking back in, giving regular feedback on their performance will really help get your NPs, from kind of that baseline foundational knowledge to where they're really a productive team member. When it comes to mentorship and support, I'll give a few pieces of advice that I see that can tend to be areas of frustration. I recommend pairing any nurse practitioner in your facility with a more experienced provider and sort of a mentorship or support relationship. Given that educational disparity, NPs are going to have questions along the way as they see patients. Even if they have experience, they're probably also seeing more complex patients along with that. So they're going to need somebody to be a go-to. One question I get a lot is, how much time is this going to take of that other individual? We need that more experienced person to also be seeing patients. What this involves is typically responding to questions throughout the workday, observing, okay, if, I as a nurse practitioner have a patient I'm not sure what to do with, I might occasionally need somebody to, come lay eyes on that patient and say, okay, I see now what you're talking about. This is what we should do next. Procedural training, if your facility involves doing a lot of procedures, that's going to be very important. NPs get notoriously little procedural training, so we'll need some help with this when they first get started, if they're newer to the profession in general, or if they're newer to your facility. And then selecting patient panels. Why not, give the more complex patients to the more experienced providers? It takes some intentionality to sort out how this is going to work with your scheduling system. But get a flag system. Number each patient 1 through 5 based on, complexity, how many medications they're on, or how many comorbidities they have. And that way your front desk or scheduling office, whoever's in charge of that, can assign based on complexity. So do some thinking about how you can more intentionally assign patients and get a structure in place so that NPs can really get some of that on-the-job training in a way that really fits within the efficient systems that your facility already has. Effective management, a little bit more on this. Feedback is something that I also see get missed a whole lot in the provider world. I think we focus so much on seeing patients, getting through those appointments, because that's how we get paid. That's really the revenue generating driver behind our facilities. But in order to make things as effective and efficient as possible, it's really important that we pause every once in a while and take stock of how we're doing. And I see, a lot of managers don't do this with their nurse practitioners. One great way to facilitate behavioral change among the providers in your practice is to give the how and the why behind the changes or activities that you need to see them doing. So one example of this would be that as an NP, I see a lot of managers say, you need to see patients faster. You need to fit more patients into your schedule. Well, all this does is really reinforce the already inefficient systems that NP, who's maybe known to be a little bit slow, is already using. They're just working harder at those inefficient processes that they already have. So give more specific feedback. Observe that NP for a day. Say, okay, instead of, just working harder, how about you, document while you're talking with the patient. That's one thing we've seen leads to success. How about you gather your supplies before you go in the patient room instead of going in the room, coming out, and having that gap in that appointment? Whatever it may be, you need to give specific how, and when it comes to things like being more efficient, rather than just general feedback. Also the why behind changes. So a lot of you all are in compliance, and compliance sometimes gets a bad rap because you're asking your NPs to do a lot of things, check a lot of boxes that may not be popular or seem worth it. And so giving the why, saying Medicare won't pay us unless you do this, and then we're all out of a job, whatever it might be. Tell people why, and giving some meaning behind those actions is very effective. Some common objections to implementing these management and feedback structures are that it takes a lot of time to train, to provide that on-the-job training, and it results in lost productivity from those mentors or those other providers who are serving as a support system. The other objection that I get is that hiring inexperienced nurse practitioners just doesn't seem worth it. So a few solutions. Number one, recognize the benefit of working with motivated, coachable providers. I really, in most settings, encourage hiring for the right person rather than the right skill level. You can bring someone, from point A to point B when it comes to their clinical skill set. And if they're a great person to work with, they're motivated and they're going to do a good job, it's worth putting in those initial months of training rather than working with somebody who's just never, going to be a great team player or going to be a good contributor to your team or going to be a stagnant provider. Create systems and processes for onboarding. It is a lot of work to onboard a new provider, but if you have a system, a written process, and a written program for doing so, this is our 8-week onboarding program. This is how we assign a mentor to each provider. That ultimately will save you time on the back end and really get this onboarding system ingrained in your facility's processes. The other option is you can outsource part of that training or education. Our company, for example, has a program called Mid-Levels for the Medically Underserved. We help facilities educate less experienced and newer graduate nurse practitioners and physician assistants with weekly online didactic education. Essentially, we meet with them online once a week for 90 minutes in the live classroom setting and have a curriculum that they follow throughout their first year of employment. And so it is possible to outsource some of this so you're not using all of the time of your own providers. There's one business adage that I really like and think applies to a lot of these objections that I get. The CFO asks the CEO, what happens if we spend time and money training our people and they leave? I hear this all the time. Well, the CEO replies, what happens if we don't and they stay, right? You're in a worse spot if you end up with somebody who's stagnant, who still doesn't know what they're doing, and they've ended up being a long-term employee in your practice. So, moving on, we will now talk about structuring compensation intentionally to help create a good practice environment, help you retain your NPs, and also help them practice in a way that works best with your facility. So why is this so important? Well, we work in a fee-for-service healthcare system. The more tests I order as a healthcare provider, the more imaging studies I order, the more labs I order, the more I get paid, right? I went to school, though, because I'm passionate about health and the human body and helping people and seeing patients. I'm not passionate about trying to sell more services, right? And this is a conflict that a lot of healthcare providers find themselves in, is that they're sort of reinforced or paid by this model that doesn't really fit with where their passions lie and where, is really a satisfying place to work. And so time, nurse practitioners' compensation to productivity lends itself to a lot of frustration. And it lends itself to job dissatisfaction. It can also lead to distrust. Calculating RVUs, and which are essentially productivity points, is a really convoluted system. And so since typically it's not transparent and providers can't really see, oh, these are my numbers very well, it's like, well, I got my paycheck. I guess it's right. I hope it's right. Maybe they think it's not correct. And so productivity-based compensation can be a detriment to your practice. The way you set up compensation can also place a lot of limitations on you as an employer. I've seen this in my own practice, having been paid on productivity previously. If you want to move your providers around maybe to a different area of the hospital or have a certain provider see certain types of patients, then the question is always like, well, how will that, affect my productivity? And so it gives you less flexibility to try different employment structures, different schedules, because your providers won't be as open to that. Another benefit of intentionally crafting compensation is that it gives nurse practitioners some upward mobility in a role that's often stagnant. As an NP, I show up at work, see patients all day, leave work, do the same thing every day over and over again. There's not a whole lot of variety in that. And there's a lot of room for upward mobility. So once you get to a point where clinically you're very strong, there's not a lot of incentive to really continue to get better, continue to push yourself. And what does that really look like for you? Maybe I guess you see more patients, maybe you move into an administrative role, but it's really nice if an employer can give you some upward mobility and a structure for how to be exceptional in their practice. And then finally, transparent expectations. Those are incredibly important. It's really nice to reinforce expectations with pay, and it makes sure that things, again, are getting done the way you want them to get done, and really outlines for your providers, hey, this is how you become an exceptional nurse practitioner at our facility. So how do you do all this? You create what I like to call a compensation levels document. And so this outlines incentives for the activities that you really want your providers to focus on. It takes into account years of experience, clinical scope of practice, and professional skill level. So we'll look at what one of these documents might look like, and then I'll talk a little bit about how you create one of these. So we have an example here. It's a couple pages long, so we'll go through those. But essentially at the top it says, providers are central to the success of this organization. The organization has spent a lot of time thinking about the clinical scope of responsibility of each of these providers, as well as the professional skills that are important for that role. Finally, the company has also evaluated the value that more experience provides our patients and organization. The organization uses 3 considerations in calculating compensation levels. The chart below gives a general overview of each consideration. So in your chart, you'll have clinical scope. This includes result-getting activities of the role, clinical skills, how much autonomy that nurse practitioner will have in practice. Professionalism, are patients satisfied with your care? How effective are you at working with the systems and processes of the organization? From a compliance perspective, do you dot your I's and cross your T's and complete trainings that are required of you, those types of things. And then experience, of course, relates to the years working in the clinical setting. So if we go to the next page, we can see here our clinical scope of practice. So this would outline, specific result-getting activities in the clinical setting. We also have experience in the top corner, which is something that you'll use. And if we go to the next page, you would have professional skills outlined. So things like developing full competency of EHR and PACS systems. So can they use the computer to the most proficient provider, which maybe holds a leadership role in the practice. Jumping back to the previous slide, what we would do is you would rate your provider when it comes to clinical scope of practice and professional skill. Then go up to this grid where we have experience and average of scope of clinical scope and professional skills in the upper right corner. So you would average their 2 scores there, weigh that alongside their years of experience, and then on the left you would be able to see, based on their numerical level, how much that particular provider would earn. So this is a way that you can really outline what it takes to be successful in your facility, and exactly the activities that nurse practitioner needs to do. It makes it very transparent how much they can earn for doing those things, and really incentivizes them to want to move up to that next level, and shows them that how behind how to do that. Eliminates arguing about raises, that sort of thing, because you've got it all laid out in front of you. So how do you create this? Step 1, to get started, imagine you have a practice with 20 providers of varying ability. How do you segment them? And that will give you a framework to start thinking about those different things that are important to you. The second thing I recommend that you do is think about everything that annoys you about the providers in your facility. Are they not completing their trainings on time? Well, put that in your levels document. Make that a requirement at the very basic level. Before you get a raise, you're going to have to complete 90% of your trainings on time. Or, are you not finishing your charts on time? To get to level 2 in our professional skill set, you need to complete 90% of your charts within 24 hours. So those types of things that sometimes fall through the cracks and tend to be a problem. So after you brainstorm this huge list, look through the list of competencies and select those that are most important to you. You might have 150 things on your list, but you probably don't want to put all of those in your levels document. So select those that are the most important. The next step would be to segment those into 5 to 7 different levels, both for clinical scope of practice and then professional skills. So we've got that clinical side and then that professional development side. And place all of those items in different levels based on the skill or scope that's required to carry each of them out. And then refine it. You want these things to be specific and measurable. Don't just say finish your charts on time, say completes 90% of charts within 24 hours, those types of things. You want this to be a document that you don't have to argue about, that is very objective, so that when it comes time for feedback and performance reviews, you've got something to fall back on, and that really supports your position as an employer. Finally, once you've got that document in place, you're going to have to assign a compensation hourly rate or salary to each level. You can do this by looking at how much nurse practitioners in your practice are currently paid as a benchmark, or you can use compensation data for your specialty and geographic location. But ideally, you want to create enough of a differential that there's an incentive to get to higher levels. The outcome of this is really, you have clear expectations. You can reinforce those expectations, and it gives you a good position to be in as an employer. So if there are any questions about that, I'm happy to answer those. Feel free to send me an email. I also have a book out called Unlocking the Value of Nurse Practitioners and Physician Assistants, and that contains this level document in there and goes into a little bit more depth about these onboarding systems and processes, as well as this compensation structure.
Great. Thank you, Aaron, and thank you, Alex, so much. Just for the sake of time here, please submit any questions you might have, and I will personally make sure that they go to the right person, and you will get a response on those. So just to close out here, I will share contact information for Alex and Aaron with anybody that's interested in contacting them or hearing what they have to say about any particular topic. And also, Provider Trust has an awesome license ebook that fits well with some of the stuff that we talked about today. It's free and you can download it on the site. We also have a blog that I will share with you all. We post frequently 2-3 times a week with a lot of relevant information that we think you will find useful. Follow us on social media and sign up for our next webinar. As I said, we are starting to submit these for CEU accreditation, and it just adds a whole other level of value to these webinars. And we continue to try to find great guests like Alex and Aaron today to make sure that you guys get the best content and the best use of your time. So with that, I just want to say thank you one last time, and I hope to see you on the next webinar.